Hi, and welcome to episode 183 of the Untethered podcast. Today we have Kelly Quolas joining us. Kelly's the founder and owner of My Health, which offers myofunctional therapy, speech therapy, and breath work in two locations, Phoenix and Mesa, Arizona, and globally via telehealth. Her practice includes registered dental hygienists and speech-language pathologists working alongside each other for the greater good of getting to the root cause and empowering and advocating for their clients. She's a licensed dental hygienist with over 20 years of specific pediatric and special needs experience and has had extensive training in the world of orofacial myofunctional therapy and the practice of Buteyko breathing, in which she's a certified Buteyko breathing practitioner. She received her specialized training initially through the International Association of Orofacial Myology and has achieved her qualification in orofacial myology through Neo Health Services. She prides herself on keeping up to date in current research and therapy modalities to benefit her clients. Her favorite thing about being an orofacial myologist is the connection and relationships she develops with each client. Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Welcome to the Untethered podcast. I am your host, Hallie. I'm a certified orofacial myologist, feeding specialist, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, tethered oral tissue, and airway space. I challenge you to keep an open mind and join my mission to get this information out to the masses. Let's get started. Welcome, Kelly, to the podcast.
Hello, thanks for having me. I'm so excited to be here.
I know we were just talking before the recording, but we've been Instagram friends forever. So I was like, I feel like I know you so well, and I'm so excited that you're here.
Same. And I know I think we kind of started our myo journey because I remember seeing you posting when you were pregnant in Myo Masters and
Yes.
oh my gosh, this lady's pregnant and going through the QOM exam. Is she crazy or what?
Yep. Hi, that's me. Yep. Crazy. That totally defines it. And
But
since
yes,
that point, we've both been on our own airway, expansion, myo, ToTs type of journeys. So I'm excited I've been following yours online, and I know that we talked about having you come on here and share a bit about your journey. So I would love for you to share with us. I know you're using a Vivos appliance. I used one as well. Just kind of share with us, what got you started on your journey?
yes. So I think we're all in this space because we have a personal connection to airway health and sleep and breathing. So I was in pediatric dentistry for over 20 years. And so you see these kids come in and out of your chair and you start to notice things. And I would say over the past 10 years, I started to notice more of these concerns and checks on health history with sleep and breathing and tonsils. And it was getting harder to manage them in the chair. And then looking back into my history, I had my kids really young. And so at 20, I was a new mom. I was in the Army. I was trying to breastfeed, and there was absolutely no support at all. And my son had a tongue tie. Fast forward, 15 years later, when I'm sitting in my first IOM course with Sandra Holtzman, and I'm like, this was me. This was my son. This was my daughter. And so my why is I don't want any mom to feel like how I felt with no resources, no support. And then also, I don't want anybody to experience motherhood like I did and have those sleepless nights and think that it was just okay and go on for years and years thinking it's because I'm a mom and I had kids and, it's not my job to get a well-rested night of sleep. And that's not the truth. And so that's why I'm here.
Love that. And I think you're absolutely right. So many of us start on this journey because we take our first course and we go, hold on. Okay, wait a second. I came back and I remember flipping Lily over in our nursing chair. I mean, she wasn't nursing anymore, but I just, got home from Sandra's course. I sat down in that chair. I had her on my lap. I kind of flipped her head, upside down, and I looked and I was like, her tongue went up, and I was like, oh, yep. Okay, let me look at her lip. There it is. And I was like, so she's 24 months old now. And now I know why the feeding experience was so painful and so challenging. And this child never could get over the first percentile for weight in her first year. And, I took her to IBCLC and was turned away. And it started exactly like, as you said, I don't want another mother to go through what I went through. And if I can educate and prevent that from happening, even on a small scale, right? That's however many other moms don't have to experience what I did. Or, right, if they're going through that, they have the resources or the know-it-all to know who to seek out, what questions to ask, what symptoms may be connected to what, right? And so, yeah, I mean, I've seen so many of us mamas like on this journey because of personal experiences. And then we all kind of look at ourselves and go like, okay, I guess it's time to focus on us
Yeah.
too.
Well, I
Yeah.
also like all of my nieces and nephews need help. And so I feel like, I'm on this planet for one purpose, but I had my oldest nephew sleeping over and, I was working in the office and I started hearing that sound and I thought he was kidding. And I looked over at him and his lips were turning blue and his mouth was wide open. And, that really started getting me. That was the pivotal moment in which I started asking questions. So I went back to the dentist I was working for at the time. And I'm like, hey, I saw my nephew do this, mouth open, snoring, his lips were turning blue. And so we kind of put our heads together and started looking at what did that look like as a pediatric dentist and a pediatric dental hygienist. So then I came across the orofacial myofunctional therapy course and it was coming to Phoenix. And so, that's kind of, all of those breadcrumbs led me to where I'm at now. And sitting in that course, I'm sure, your experience too is just lightning bolts, fireworks, and oh my Lanta, I'm seeing this in every kid in my chair. And, I need to put my armor on and start knocking down doors and throwing kids over my shoulder.
Yeah, no, I
Yeah.
came back and I was like, hi, can I assess your child for free this week? I was like, you're already on my caseload. I won't charge you extra. I'm seeing you for a session, but do you mind if I do this myo assessment? And then it changed the trajectory of how I looked at the children in front of me and how I approached them in therapy as well. And not all of them, they weren't all there for the same reason, but for the kiddos who had speech sound disorders, who were on my feeding caseload, kids who were drooling, open mouth posture, all the things we learn about in that intro course. And we're kind of going, okay, there's more going on here. And then I started to look at the kids who had like certain behaviors, like the off the wall kiddos who can never really calm down and who are super sensory seeking. And I started going, I wonder about their airway and their sleep. I mean, it was just like this, like the rabbit hole had been opened and I was deep down that rabbit hole. Like it was.
Yes, I think we all were after that course. And so, I'm so grateful because I've been able to, we're going to talk about our Vivos journey, but I've been able to help myself become a better mother, a better partner, a better sister. And so like, that's transformative. And, I had one patient in when I was still practicing clinical that said, I went to the ENT and I got her tonsils and adenoids out and she is a different kid. And I just want to say thank you. And, to me, that really hit home. I'm like, okay, I have to pivot myself. So like you, I was going to people's homes for free. I was doing free myo for quite a while just to get some hands-on experience. And, these families were willing and they were at the point where they were inviting me into their homes and wanting help. And so the need is there and it's just such a rewarding career. It's just I love what I do. So, yeah.
I mean, you're changing the trajectory of someone's health.
Yeah.
And I think I look at it as giving them a lease on life. Like we are literally taking these children who are headed toward maybe ADHD medications, depression, increased anxiety, struggles in school. I mean, the list goes on, feeding challenges, nutritional deficiencies, like all kinds of issues that, not that every child has every single one of these issues, but we see this across the gamut.
Yeah.
And if we, I tell everyone, if we can intervene during childhood, whether that is like the little ones, or we're talking about, anywhere up through like teens before young adulthood into, before the college years, like we work with all ages, we work with college adults, et cetera. There is no limit who we will work with, like, on my own, I know your practice, sees the whole lifespan too. I know you've even got some SLPs, I think, that work with you as well, which is awesome. So, all this to say, like, if we can change a trajectory, we can change the anatomy, if we can change the soft tissue, if we can change the way we're breathing and sleeping and chewing and all swallowing, all that fun stuff, it's literally changing health trajectories, and I think arguably causing less stress to the system. And we know stress causes most of the ailments in life. So, we could go talk about that all day long, but
Yeah.
it's really amazing. It's amazing work. And, I've had those situations too, where like a child gets tonsils or adenoids out and, oh my gosh, all of a sudden they're a different kid. Like I don't recognize my child but this is like for the better. They're totally different. And all these symptoms we were seeing before that we didn't really realize was a major, major issue. Like now we see it was a major, major issue, but we were the first ones to really bring it to their attention and help them advocate for what was needed for that child. And so, I think we all have these types of stories that just absolutely makes the work that we do like 100% worth it.
So worth it. So worth it. Yeah. And I was the kid that had the tonsils and adenoids and the tubes and frequent ear infections. I have a strong memory of being out on the playground and not hearing the whistle and crying because I couldn't find my classmates and my teacher. And then nightmares, my whole life, nightmares. Being in the military, I had some PTSD. So I'm sure like all of that kind of connected to where my airway journey led me. And now, going through myo myself, retraining my body on how to breathe better. I have to be that example that I'm showing to my clients, but also it's helpful because I feel like a different person. And so using the Vivos appliance has definitely transformed my sleep and just really like at this stage of my life, I'm 43, my hormones are changing and, I want to be the best person I can be. And so I feel grateful knowing all the things that I know and how to, connect with the right practitioners. So yeah, I feel that there's value in information too. And we're here to deliver that.
Yeah, no, I think it's amazing that you practice what you preach. Like, I think it's hard because it is a journey. It is not a quick fix. It is definitely a journey and a big commitment. I think that going through some of this myself really helped me connect on a much deeper level with my patients and with parents of my patients, just as the mom who's been through it with their kids, as me, myself, as the patient, you just have this different level of like appreciation. And I think, these, the parents especially, and sometimes even the kids are like, oh, wow, you do that too. You have the same thing or you did this already. Or, it normalizes it in a sense, and it makes it a little bit less scary because it is a journey. It is a commitment. And there's a lot of pieces to this puzzle. But I'm curious to know, like, how did you come to pick your specific appliance? And is it the DNA Vivos that you're using, or can you tell us about what you picked and why?
It's the Vivos DNA. And so I worked with a few clients that had the Vivos appliance. And I also worked with a client that worked with Dr. Ted Belfour, who had a BioBlock system. And so, kind of just seeing that experience from being on the other side of the table with them or the computer. And gosh, their sleep is getting better. I'm like talking to myself, oh, wow, this is really cool. And so, this career too is you're constantly learning, you're constantly researching. And so I did a lot of that deep digging. And then it was serendipitous where I had a practitioner, a dentist, reach out to me and cold call me and say, hey, I came across your website and I see that you guys have myofunctional therapy and you can teach people how to breathe from their nose. Well, I just bought into the Vivos system. And I was like, oh, like I had just literally like looked at the map of practitioners and I was planning on hitting the pavement. And like, that's how things work. I don't know if it works like that for you, but that's how it works, how it's worked for me so far. And so we connected and then, talked about our patients that we were seeing collaboratively. And I felt like this was the best appliance for me, seeing the results, reading the research. And then I had also heard Dr. Dave Singh, who is no longer affiliated with Vivos, and Dr. Liao, who's no longer affiliated, but I heard them speak when they came out here 2 or 3 times. And I was just blown away with how much they've poured into researching the science behind it. And so all of those things, I was like, okay, let's do this. And, we went and did our records and things like that. And of course, I think too, it's probably similar when we started I started this in 2017. It was like tongue tie, tongue tie, tongue tie. And I really wanted to get my tongue tie released because I knew I had one, but I didn't have enough oral volume. I didn't have enough tongue space. And so was, what are my options here? And then this Vivos also I knew could help me with that. And so it's been really practical because I can take it out when I'm working with my clients and put it in, but that's also the downside too.
Right. Everyone's like, why were you in it for 2 years? And I was like, well, there's a number of reasons. One of which I only wore it 8 hours a day because I talk for a living. I was like, and I needed my mouth for what I do. I was like, and two, like, I think just from cranial strain patterns and things like that, like I sometimes had to go see my PT who was PRI trained to like unlock me before I could actually crank it and like put it back in, because it just like halfway through the treatment, it got to that point where I was like, I need to see Manny before I can like crank this again. And yeah, so I moved slow, but I did what worked for me.
Yeah. And so you wore yours for 2 years, done now?
I did.
Okay.
I wore it for 2 years. And then I admittedly was like, oh, I don't love all these spaces. I'm a little vain. I don't love all these spaces in between my teeth, especially on the sides. I felt they were really, really visible. So I went into Invisalign,
Okay.
which I then learned from presenting with some dentists in the airway space. They were like, yeah, don't do the last couple sets of trays because it actually retracts you. And I was like, you couldn't have told me that 4 weeks ago because I just finished them. And I was like, and I see what you're saying. So now it's like, I need to go back and do another appliance. I don't know.
Oh,
So,
yeah, because I heard you mention that on one of your previous podcasts. And that's kind of like me, I'm a dental hygienist. And so teeth are everything. And so, but you know what? I thought I would have more value in the aesthetics. I don't, because my reward is I feel better, I'm sleeping better, my head's clearer, I'm not as foggy. And so, like, it's really what's more valuable to me. And to me, it's the health benefit as opposed to aesthetics. Now, don't get me wrong, honey. I love the way that my face is looking. I love all of that too.
got cheekbones.
Exactly. So, I had some slides of the pre and my checkup, and I'm in it for a year now. And so he basically, his name's Dr. Fatai at Scottsdale Family Smiles. But he said I could probably wear it another 6 months to a year if I desire to do so, which I think I'm going to. I think I'm going to see how long I can go and how much growth I can get out of it. And growth, I mean my airway, and then go from there. And I had my tie released in February. Yeah, end of February. So 6 months now. And just the amount of tongue space I have is crazy, like crazy. Swallowing, I know we work with people on swallowing and tongue thrusts, but I understand from a patient perspective of how the limitation in your oral space can definitely inhibit a functional swallow. And it's just so much easier now. So that's part of the pathway, is we want to make things easy and attainable for our patients' clients, and make sure we're looking at those barriers of why we're seeing the dysfunction in the first place. So this is a tool in our toolbox.
Yeah, no. And I honestly, I loved it. It was bulky. And I noticed that like my tongue would sit in between it. I did have my tongue tie released before the appliance, but it was sort of done like in chunks, not as a cohesive plan. I would do things differently now. It was like, I have enough space to get away with a tongue tie release, but I also have lower tone, and my body just heals very quickly, very differently. I don't really feel a ton of pain. I think a very high pain tolerance. So like no pain, just like a teeny bit of discomfort, a little hard to eat, like the night that I had my tongue released, but also it started to heal on itself to more of like a triangle versus a diamond, like immediately. And I've now learned that I possibly have like EDS. I possibly have, just my body heals differently. So probably should have had it sutured. It's not perfect, but it semi-fits. So I think between my body like locking up, my maxilla still turned in on one side. I definitely am not done in my journey, but I kind of was like, pump the brakes on the dental stuff at the moment, because I got benefit out of using the Vivos DNA. I definitely could breathe easier at night. I think my sleep did improve to a certain extent. However, aside from the fact that I retracted myself a little bit with Invisalign afterwards, unintentionally, I had a deviated septum. And when you looked at me, you couldn't necessarily tell really, really well because it was deviated in like the posterior third. So it was kind of hidden back here, but I really couldn't breathe very well at all throughout this, like the left side of my nose. And so I think that plus enlarged turbinates, plus enlarged nasal swell bodies, like all of that was, I think, impacting me in a way that I wasn't feeling the full benefit from the appliance work and the growth that I had. I was feeling some, but I'm like, why does everyone else have they have much better, relief? And I didn't have migraines. I wasn't a very unhealthy individual to begin with, in my opinion, but it was more like my body's always inflamed. I'm always tired. Like it was like, fatigue, having a lot of fatigue and inflammation more so than, I've had patients who are really just, it's completely debilitating. Like they can't get out of bed in the morning. And that wasn't me. So I was like, oh, maybe my symptoms were more mild, so my results are more mild. I don't know. I do think that going back after my nose is healed, like I don't want to mess with anything because I also had a rhinoplasty. So I'm giving it a full year and we're about 5 months into that. I want to see what we can do now that my nasal airway is patent. And like once all the inflammation is down, like fully down at the 12-month mark, I'd be curious to see, like, do we think another appliance, like even another Vivos DNA may be a good route for me? Because I think now my facial anatomy would support the growth and would sustain it. And now, and I'd be curious to see if we could like unlock and kind of like shift my maxilla, because we did get some movement, it just wasn't holding. And so we couldn't really get it to go any further. And that was a combination of using the appliance and having my PRI trained PT who did what he called modern counter strain technique. So, I definitely feel like I was doing all the things, but sometimes like we hit a wall and it's kind of like, okay, what now? And finally I was like, what now is nasal surgery. So here we are 5 months later, and I am very happy that I did it. I definitely can breathe better. I did a sleep study like right before the home sleep test with Ken Hooks, and I'm going to do another one. I want to do it once I know a majority of the swelling is down, because I don't know that it'll be super beneficial to do it yet. But he and I go over it on one of my podcast episodes. And one of the things that we noticed was as soon as my body went into that like deeper sleep or into REM sleep, it was like, nope, pop you right out. So I was never actually getting REM sleep during the majority of the night. And I'm like, well, no wonder I feel like I don't sleep, and I'd rather stay up late and just get things done, because I'm not getting restful, restorative sleep anyways, even if I do go lay in bed and, think I'm sleeping. So anywho.
Yeah, that's like where I'm at too. I had a sleep study before. And so that's pretty much standard, right? And so I didn't really have anything that, nobody in the space would look at and say, oh, you got this or you got that. But I had my AHI was 3, but my RDI was a little concerning. And, I just, prior to my journey with myo release, breathwork, Vivos, I was waking up multiple times a night. I was sweating through my sheets. And I thought that was just my old lady hormones. But, I was like in my late 30s. So, those were something for me that was life altering. I was getting migraines, cyclic migraines every Wednesday. I remember calling a client laying on the floor of my office. I cannot go the rest of my day. And that's debilitating, especially when you're a business owner and then you're, a healthcare practitioner. So for me, I have maybe had 4 migraines since in a year where I was having them weekly. My neck is definitely in a better place, like, occupationally being in dental, that long, my neck was just jacked. And so now I have better extension, range of motion, and which even improved after my tie release, which was really interesting. And just, overall, I'm definitely feeling more rested. When I wake up, I'm not like, laying in bed. And I don't get that like sluggish, that afternoon sluggish, I need a coffee anymore, which was pretty much coffee after lunchtime, for 15, 20 years.
Yeah.
So
Amazing.
it's been, for me, I didn't have the nasal issues, but I did have TNA surgery back in the day. Now with my partner, we're getting ready to put him through this journey, and he's having his surgery next month. He's having a septoplasty and turbinate reduction. And, there's been some health issues. He's got some cardiovascular issues, hypertension, AFib. And so I know talking to his ENT and his cardiologist, they say sleep is everything. And I told them, I'm like, I'm so happy you're saying that.
Yeah.
And to make that connection of how restorative sleep needs to be when you have these inflammatory concerns, we have to be looking at the quality, not the hours, the quality of these people's sleep. So
yeah, that's amazing. So you talked a lot about like your symptom improvements. Do you see, and I know that this is primarily the appliance that you've used, but you've seen some patients and others. Are there like pros or cons to the Vivos appliance that you notice? I mean, I know we kind of talked about a few being that obviously it's removable. And so that can be a con sometimes. It's a pro and a con in of itself, but any other like pros or cons that you've noticed as a user?
Yeah. So as a user, it's, for one, it's keeping up with the time that you're supposed to wear it, of course. And then it's hard to communicate. So it's kind of, you get frustrated when you're trying to communicate, and it's hard because there's this block between your palate and your appliance and your
time to speak very well, and it's hard to close your lips. So
Yep. So that's frustrating. So I usually have to take it out, and I'm, like, didn't you understand me? Especially after wearing it for a year, honey. So that's another con. And then I guess the aesthetic part about it is my teeth look different, and they're shifted, and there's spaces, and I have, a diastema now where I didn't before. And, taking it out to eat and keeping it clean. So I mean, I guess it's like on the low end of inconveniences for what it's worth. But then, in regards to being on the other side of that, being the therapist, I see that there is definitely a patient selection concern. And when I met with the Vivos reps, when they came out here a few years ago, they were really interested in talking to Audrey and I. Audrey works alongside of me, and about myofunctional therapy. And I feel like there needs to be a little more connection to these Vivos providers for sure, because I also am on a Vivos support group on Facebook, and how you kind of like are a silent reader. And I hear lots of questions coming from these patients who don't have a lot of background on like where their tongue's supposed to be, how they're supposed to breathe. They have ties, but what are the steps on releasing if so, and things like that. So I feel like it's so valuable to be working prior to the appliance and kind of going through a screening process in regards to barriers. So like in your case, the nasal breathing and things like that, because, it can be costly. And I think I mentioned that when, I sent over my little bullet points, but access to care and cost is definitely another con. I do have a client I'm working with who's a dentist who we've discussed, like she's able to get it covered through her medical because it does qualify as a sleep apnea treatment. And so, but it's not well known how to write that out and how to code it and how to bill it. So that's another thing I feel like we can get really good at as another tool for these people that need it.
Yeah. I mean, that's one, you nailed it. I have so many patients who come back to me, and it's not just this appliance, it's a lot of these growth appliances.
Yeah.
And I think, especially if you work with, young children or people who have already paid for braces and expansion in the past, it's just, you're not expecting to do this all over again or to spend this much at such a young age, for your child. And we get this all the time where it's like, oh, wow, like I didn't realize it was going to be that much of a financial investment. Like that's a little bit prohibitory for many people, not a little bit, very prohibitory. And so, I think it comes down to in such an insurance driven world, like you said, figuring out, okay, how can we run this through insurance so that at least, if not all, at least a portion of it is paid for to make this more accessible. Because I know that like I think it's the Vivos mRNA has become more widely acceptable as like a sleep apnea covered type of appliance, but arguably the Vivos DNA should be too.
Mhm.
And I think that, I guess the other flip side to that is people like me who don't present as having sleep apnea. Well, what about like I still had a sleep study, Ken reviewed it. We found that I never go into REM sleep. Like arguably from a health standpoint, I'm at the same risks as people who do fall on the sleep apnea scale per, insurance, how they're going to code something or whatever. Um, and lots of people haven't heard of UARS. People don't know what upper airway resistance syndrome is, right? And it's like there is actually a code for it, but people haven't heard about it. And so I think just the advocacy like surrounding getting these things covered, and then also, like you said, like helping patients to even be aware that like, hey, this may be something that you can get covered. But you're going to have to put a lot of legwork into the process, because it's such a shame to me that that's what stands between like, everything we've talked about, right? Like just putting a child on the path to better health and giving them the best lease on life, putting an adult on a better health path so that they are not on a dozen medications and, struggling in their mid 30s or their 50s or their 70s, or, it's what can we be doing to ultimately lower healthcare costs? And I don't really want to go into that conversation, but it's, I think that being proactive and using things like this, paying for things like this, getting things like this covered is really, personally, I think it's the best answer, but I might be a little biased, but
Yeah, like you said, not specifically Vivos, but it's like I have a hard time, in this field, like with the access to care. I have to keep my doors open and things like that. And so it would be lovely if there was a way that we can get this, not only the appliance, but also therapy and education and things that we can do. Like I remember you talking about on one of your previous podcasts about going into preschools and just bringing up that awareness and that knowledge so parents have more power to help their child with their health journey. And so it kind of got off on a tangent there, but with things that help us be better in general in health and wellness, we have to look at it that way too. So we can deliver it to other populations as well, because that's what we're here for.
Absolutely. And being a private pay practice, owner, it's at the end of the day, like I have to pay my people who are providing this highly skilled service that they spend thousands and thousands of dollars per year to not just learn about this skill set and, but hone their skill set and continue to keep up with the latest research and the latest, patient care and discussions and, collaborative attempt to deliver the best therapy, to our patients, which I'm sure you get. And it's nice because as an SLP, I can provide a super bill. It doesn't mean it's always going to be covered. We do try to help patients get it covered. And, one of the things that I encourage patients to look at is like, what are your out of network benefits? Number one.
Yeah.
Number two, if someone doesn't have the skill set that's in network, then arguably insurance should have to cover it. So like, let's figure that out. Like talk to a rep at your insurance company. And then lastly, kind of figuring out, well, what else is going to happen, right? Like, where can we start to reprioritize things if we don't address this now? Not to like, not in a fearful way, but like, if we're not addressing this now and we're going to wait a year or two, like at what expense?
Yeah.
Based on the case that we're seeing in front of us right now, and just having a good understanding so that an educated decision can be made by the parent and whatever the parent or patient, right? Whatever they choose, great, that's their choice, but at least I know I've done my job in educating them and helping them kind of lay all the pieces of the puzzle out and really get a good full picture on like, here's what we're recommending. This would be the best case scenario approach, but we're willing to work with you and figure out what should be step one if we're only going to do like one piece of the puzzle at a time. So I know we get very crafty in our approach to work with patients, and it can be very hard to, I think, access, not just like you said, not just the appliances, but the cost of therapy. So it's definitely, I feel like we have more people who are getting trained. There are more options to receive therapy, in the myofunctional space now, which is great. And I'm like, I just hope that it continues to expand and it becomes a more normalized type of conversation and therapy and process that people go through it's like, oh, I got myo today. Like, no big thing.
Yeah, like I went to speech and she gave me candies.
Right. Exactly. I went to speech at school. I went to myo at school. Right.
Yep. But that's a perfect world. But with, getting back to the Vivos appliance, like I said, it's a tool in our toolbox. We know it can help with airway and sleep and just in general quality of life. And so it does cross the gap between adults and children. I have a handful of clients that are children that are in Vivos, but they fit a specific scenario. So they're very compliant. The parents are super on board. But I have to say, there's been amongst everyone, there's been an instance where they've lost it. And so that is a definite consideration. I actually threw mine in the dumpster on accident.
Oh, no.
I went dumpster diving. So I just have to say that's a big con. But I found it. It's here.
Yeah. That's why we ended up putting the permanent retainers that I was like an orthodontic relapse case. So when I was a teen, they put permanent retainers in my mouth because I never wore them or lost that. It's like, that's what happens with these removable appliances.
Yeah.
So it's a little tricky in that regard.
Yeah, but you have to know that based on who you're seeing, that could be an option. But then on the other hand, if compliance, behavior, parent involvement, I know that I have resources to help them and referrals to do so. But I think across the board, we really need to be looking at these barriers, nasal patency, breathing reeducation, having some awareness of where the tongue needs to go and helping work through that process prior to any intervention with appliances. I see that across the board in our clients and also in my personal journey. There is no way I would have been as comfortable as I have been with this appliance if I didn't have a really strong awareness of nasal breathing and oral rest posture. So I feel like that needs to go hand in hand before, I look at it as just a Band-Aid if you're not really getting to the behavioral component. So I have to just throw that out there, and, providers that are offering Vivos, making sure that they're working with the orofacial myologist prior is where I see that that's where there's more success.
I love that. And we talk a lot about that as far as tongue tie release goes with needing that pre-op and needing that post-op and seeing a big difference in patients who receive pre and post versus those who receive only one or neither. So it's a fascinating conversation to have too, regarding appliances, right? And knowing what we need to, I think that one of the things that I think about a lot too, and I think this comes from my feeding background, is a patient needs to understand their orofacial complex. They need to be able to feel and know what we're talking about and understand, see the changes, right? And how do we see the changes in our mouth? Well, we feel them with our tongue, right? We feel them, the difference in the food that we can chew or move around our mouth. And I've had anywhere from kids to adults say to me oh, wow, my tongue fits better. Or, oh my gosh, that was a lot easier to chew. What happened? What changed? I'm like, well, look at all the work we've been doing, right? Or, oh, that didn't hurt when I swallowed it. Or, I haven't been as gassy after eating. Well, you're not swallowing air anymore. It's there's all these things that they start to pick up on. They may not know why necessarily, but when you do that pre-work, and then you go through this process of whether it's a tongue tie release, it's myo, it's expansion, or it's all of the above, they start to appreciate and own the changes and the improvements. And then you get their natural buy-in because they're like, oh, wow, I'm sleeping better. I feel better. I can chew my food better. My speech is clear, all these just different things that sometimes that we work on directly and sometimes that happen as a byproduct of what we're doing. That's so cool. That's just super cool when they can start to verbalize what they're seeing. And I'm like, well, I'm so glad that you noticed this.
Yeah. I have clients' moms reach out to me or, text and, oh my gosh, my nephew, my niece, this or that. And so, to me, I'm like, oh, thank you. They're seeing it. They're looking at it differently. And so, whoever else is in their life, they're going to pass on the information that we're giving them. And it's going to start trickling down like little wonderful airway raindrops.
I love
it. So that, it's really imperative that across the board, while we're working with this population, that we're looking at the whole person, the whole picture. And I know we say this over and over again, but we need to keep saying it until everybody's on the same page.
Yeah, absolutely. Well, this has been amazing. Tell everybody where they can find you, your website, your IG, share it all.
So my health is pretty much my handle on everything. I'm on IG, I'm on Facebook, I love TikTok, and I'm on TikTok is underscore my myo. And so, yeah, you can find us there, ask me questions. I'm an open book. I love kind of helping people find their journey. And thank you so much for having me, Hallie.
Of course. And I just have to say, I love your videos, your reels, your stuff. They're so good.
Thank you. It's my little creative output, I have to say.
I love it. Well, this has been amazing. Thank you so much for joining me.
Thanks, Hallie.
Thanks for listening to this podcast. If you want to hear more of these myo, ToTs, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts or pledge a small amount on patreon.com/the Untethered Podcast. If you found value, others in this space will too. So be sure to share this episode on your social media platforms and join us over on Facebook, on my Facebook page at Hallie Bulkin Biz, on Instagram at Hallie Bulkin, and you can head over to theuntetheredpodcast.com to grab a copy of the show notes, where you can also subscribe to be kept up to date on the latest podcast episodes.